Namaste Vidya, Hamisha Khush ho Vidya. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series, we are going to discuss about glomerulonephritis. Glomerulonephritis is a very vast topic, and we are going to cover this topic in 3 lectures. So in this series of glomerulonephritis, today we are going to discuss about nephrotic syndrome. Although nephrotic syndrome we have already discussed in our previous lectures, but many times only nephrotic syndrome is asked in the examination. So this is the second time, and in a different way I'm discussing nephrotic syndrome with you today. So let's start with nephrotic syndrome. Glomerulonephritis basically involves the various diseases that are involved with the glomerulus of the kidney. So glomerular diseases, these account for a significant proportion of acute and chronic kidney injuries or the diseases. So in the glomerular diseases, we have a significant proportion of acute and chronic kidney diseases. And the glomerular damage, it can be due to, number 1, immunological injuries. Number 2, it can be due to the inherited abnormalities, that is the Alport syndrome. It can be due to the metabolic stress that includes the diabetes mellitus. And it can be due to the deposition of the extraneous material, example, amyloid. And there can be direct injury to the glomerular cells. So glomerular diseases, what are glomerular diseases? These accounts for the significant proportion of acute and chronic kidney disease that we encounter. So glomerular damage, it can be due to multiple factors. Number 1, it can be due to immunological injury. It can be due to the inherited abnormalities. One of that abnormality is Alport syndrome. It can be due to the metabolic stress as seen in case of diabetes mellitus. Disposition of extraneous material. Deposition of the extraneous material, example, amyloid deposition in the kidneys, and a direct injury to the glomerular cells. Now, what are the characteristics of glomerular disease? Whenever a patient of glomerular disease is coming to us, what are the clinical features or what are the characters that we are going to observe? The characteristic of glomerular disease includes, number 1, leakage of the cells and macromolecules across the glomerular filtration barrier. So we are going to see the leakage of the cells and the macromolecules across the glomerular filtration barrier. We will also observe proteinuria. We can also see hematuria and loss of filtration capacity, that is GFR. So there will be proteinuria, there will be hematuria, that is blood in urine, and there will be loss of filtration capacity of the glomeruli, that is the glomerular filtration rate is deranged. The patient can also present with hypertension, that is increased blood pressure. The response to the glomerular injury varies according to the nature of insult. So the more the insult, the more the involvement of the glomeruli, there will be more and more injury. One extreme specific injury to podocytes causes proteinuria and nephrotic syndrome. So a specific injury to the podocytes are basically the cells. It causes proteinuria and nephrotic syndrome. At the other spectrum, there are inflammation that results in the cell damage. So at other spectrums, there is different type of inflammation that leads to the cell damage and proliferation, and it breaks from glomerular basement membrane to the blood leaks into the urine. So at the other spectrum, we have inflammation that is leading to the cell damage and proliferations, and this breaks the glomerular basement membrane and the blood leaks into the urine. So there is leakage of blood into the urine. In the extreme form, which acute sodium retention and hypertension disease, it is called as nephrotic syndrome. So in the extreme form of the disease in which there is sodium retention of sodium in the body, and hypertension diseases, that is known as the nephrotic syndrome. So sodium retention and hypertension, it is responsible for nephritic syndrome. So we have 2 diseases. One, there are 2 ends of the glomerular diseases. At one end we have nephrotic syndrome, and the other end we have nephritic syndrome. A picture is given in your book related to the whole transition. So in the nephrotic syndrome at one end and nephritic syndrome at the other end. In the nephrotic syndrome, we are going to see injury to the podocytes, changed architecture, scarring, deposition of the matrix, and the other elements. And in the nephritic syndrome, the mechanism involves inflammation, reactive cell proliferation, breaks in the glomerular basement membrane, and crescent formation. Now we come to the glomerulonephritis. What is glomerulonephritis? Glomerulonephritis is the inflammation of the glomeruli. In the whole glomerulonephritis, the important features includes proteinuria and hematuria. These are the most important symptoms that we are going to observe. So glomerulonephritis is the inflammation of the glomeruli, which are structures in the kidney that are made up of tiny blood vessels. These knots of the vessels help filter our blood and remove the excess fluids. If the glomeruli are damaged, then the kidneys stop working properly and may lead to the kidney failure. So if there is any glomerular damage, the kidneys will stop functioning properly and it may lead to the kidney failure later on. So glomerulonephritis, there is inflammation of the glomeruli and the structure of the kidney that made up of tiny blood vessels. They knot up the vessels and help filter your blood and remove the excess of fluids. Now, if the glomeruli is damaged, then the kidney will stop functioning properly and it will ultimately lead to the renal failure. We have already discussed the renal failure in the previous lectures. Now, what are the presentation of glomerular diseases? Whenever a patient of glomerular diseases is coming to us, then he may present with the nephrotic syndrome. The patient may produce with the nephritic syndrome, and there can be progressive renal failure. So there are three conditions: nephrotic syndrome, nephritic syndrome, and progressive renal failure. The nephrotic syndrome is characterized by proteinuria. Nephritic syndrome is characterized by hematuria. So in the nephrotic syndrome, there will be proteinuria with a loss of greater than 3.5 gram of protein per day. There will be hyperproteinemia, edema, and hyperlipidemia. So in the nephrotic syndrome or proteinuria, there will be proteinuria greater than 3.5 gram of protein per day. There will be hyperproteinemia, that is decreased quantity of protein in the blood. There will be edema, that is swelling, and hyperlipidemia. So there will be proteinuria, hyperproteinemia, edema, and hyperlipidemia. In the nephritic syndrome, there will be hematuria. Hematuria with a lesser amount of proteinuria. So there will be in nephritic syndrome more of hematuria, and in a lesser state there will be proteinuria. And also there will be hypertension, so increased blood pressure. And the third condition is the progressive renal failure. Now we will discuss about nephrotic syndrome first. Nephrotic syndrome is a clinical condition in which there is, so in the nephrotic syndrome, there will be edema, that is swelling will be present. There will be proteinuria, hypoproteinemia. So there will be edema, proteinuria, hypoproteinemia, irrespective of the etiology. So in the nephrotic syndrome, the patient will complain of edema. There will be swelling, there will be proteinuria, and there will be hypoproteinemia. So three conditions will be there: swelling, edema, proteinuria, and hypoproteinemia, and irrespective of the etiology, without any cause. So the cause is not known, or the other additional abnormal clinical features. So the patient will have proteinuria, there will be edema and hyperproteinemia, all related to the proteins, protein loss from the body, irrespective of the etiology or any other abnormal condition or the clinical features. The nephrotic syndrome is characterized by heavy proteinuria of greater than 3.5 gram of protein loss per 1.73 meters square body surface area in 24 hours. And it is associated, the nephrotic syndrome is associated with hypoalbuminemia. There will be edema. So there will be hypoalbuminemia, edema, hyperlipidemia, and hypercoagulable states. So with the nephrotic syndrome, there will be hypoalbuminemia, that is decreased albumin content. There will be edema, hyperlipidemia, and hypercoagulable states that will be present. The etiology, the exact etiology is not known. Hence, it is known as idiopathic. There can be primary glomerular disease or the secondary causes. So in the primary glomerular diseases, there will be minimal change disease, There will be focal segmental glomerulosclerosis. There can be membranous nephropathy. There can be membranoproliferative glomerulonephritis and IgA nephropathy. So in the primary glomerular disease, we will be having minimal change disease. There will be focal segmental glomerulosclerosis. There will be membranous nephropathy, membranoproliferative glomerulonephritis, and IgA nephropathy. Now, what are the clinical features in case of nephrotic syndrome? Whenever a patient of nephrotic syndrome is coming to us, we have to observe the following things. Nephrotic syndrome is common in the adulthood with a peak incidence of 2 to 3 years. Male is to female ratio is 2.5:1 and it is equal in adults. There will be peripheral edema in the lower limbs and the face and abdomen is affected in children. There will be generalized anasarca or generalized swelling. In the GI tract, there will be anorexia with severe malnutrition. So there will be peripheral edema in the lower limbs, the face and abdomen affected in the children with generalized anasarca. In the GI complaint, there will be anorexia with severe malnutrition. There will be diarrhea and vomiting due to edema of the intestinal wall. In the general features, there will be anorexia, lethargy, and tiredness. There will be infrequent infections and muscle wasting with dyspnea that can occur. The blood pressure will be raised, that is known as hypertension. So, nephrotic syndrome is commonly occurring in the childhood with a peak incidence of 2 to 3 years. In the children, male is more affected with 2.5:1 ratio, and the ratio is equal in adults. There will be peripheral edema in the lower limbs with face and abdomen affected in children. There will be generalized anasarca, and GI system is more affected with anorexia and severe malnutrition. The patient will complain of diarrhea and vomiting due to edema of the intestinal wall. In general features, there will be anorexia, lethargy, tiredness, frequent infections and muscle wasting, and dyspnea may occur. There will be hypertension or the raised blood pressure. In the lab finding, we can go for urine examination, blood test, and renal biopsy. In the urine examination, there will be oliguria, proteinuria, and presence of cast. So, urine will be less, that is known as oliguria. There will be proteinuria with a protein greater than 5 grams per day, and cast will be there, and that includes fatty cast. In the blood, there will be anemia. Anemia can be normochromic anemia, hypoalbuminemia, and hyperlipoproteinemia. In case the diagnosis cannot be done, renal biopsy is usually performed. Now, what is the prognosis? The prognosis, 90% of the children respond to prednisolone. Prednisolone is basically a steroid. And in the adult, the response rate is 60%. But the relapse rate is very high. Once affected and treated by the nephrotic syndrome, the patient has a very greater chances for development of this disease again. Now, management. The general management includes fluid restriction. The fluid has to be restricted in the patient with low sodium diet, rest, and this helps in controlling edema. Corticosteroids can be given, which produces rapid and complete remission, and immunosuppressive drugs, which includes cyclophosphamide. So in the management, we have general management includes fluid restriction, low sodium diet. This helps in controlling edema. Corticosteroids that produces rapid and complete remission, and immunosuppressive drugs that include cyclophosphamide. So this is all about nephrotic syndrome. In the next lecture, we are going to discuss about the nephritic syndrome. So it's your homework to go through your book and you have to write about the etiopathogenesis, clinical features, investigation, and management of the nephrotic syndrome. So this was all for today. We will be meeting in the next lecture tomorrow. So this session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with the digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.